which is an initiative supported by Roche. I am your host, Dr. Behjat, and today we'll be discussing about risk factors for lung cancer. And to discuss about this very critical health issue, I have a special guest with me. I have with me Dr. K. Sudheer Reddy, who's a senior medical oncologist and hematologist at Omega Cancer Care Hospital, Kurnool. Welcome to the discussion, sir, and thanks for taking out time from your busy schedule and joining us for this awareness session. You are on mute, sir. If you could unmute. Yeah. Welcome.
Good evening, madam. Thank you very much for this opportunity.
So, starting with the most pertinent question, when we talk about lung cancer, what are the risk factors and why they are important to, for general people to know about?
As you know, lung cancer is the second most common malignancy, which is common in the worldwide. So it will become very important for all of us to know about the risk factors so that we can keep away from all those risk factors and prevent that particular cancer. The most important risk factor for lung cancer is going to be the tobacco smoking. So tobacco smoking is a leading risk factor, which is 80% of the lung cancer deaths can be prevented just by quitting tobacco in the form of chewing tobacco, in the form of smoking, or in any other forms. There are two types of lung cancers. One is non-small cell lung cancer and small cell lung cancer. Nearly 100% of the patients with small cell lung cancer might have smoked at one point of time or the other. If they deny smoking history, that means they are not telling the truth. So in non-small cell lung cancer patients, there may be certain subset of patients who have not smoked, but in all small cell lung cancer patients might have smoked at one point of the time or the other. So that is the reason why avoiding or quitting smoking makes an important pertinent factor for all those people whoever want to keep away from this particular dreadful disease. Second most important risk factor is going to be the radon gas, which is a radioactive gas, which we cannot see, it's not visible, which is not we cannot smell it, but it is there everywhere in the environment. So there are certain areas in the world, certain geographical areas where radon gas is common. Over a period of time, whenever this radon gas is present in particular areas, it is there in the industrial areas, it is there in the geographical, it is there in the residential areas also. So whenever a particular person or a particular person is exposed to that radon gas, slowly that particular radon gas will damage the lung over a period of time. Nearly it takes some certain years to cause the lung injury, and then over a period of time it can cause cancer. So the problem with this radon gas exposure is there are no specific symptoms or the signs from which we can detect all those people who have been exposed to this radon gas. The only symptom or sign which is there is whenever these patients get that particular cancer, and then only all those symptoms will come out. Third and most important thing is going to be the asbestos. There are certain occupational areas where certain chemicals are used, and when these chemicals are, when a particular person is exposed to these particular chemicals, they are at a higher risk of getting lung cancer. The most common is going to be asbestos, which is commonly used in electrical insulator, units which are manufacturing electrical insulators, cement industries, and pesticides, insecticides, units manufacturing insecticides, pesticides, paints. The painters are, most of these paints have got complex chemicals. So when painters are repeatedly exposed to certain chemicals, they are at a higher risk of getting this particular lung cancer. And the next most common important thing is there are certain things which are not in our hand. One is genetics, which we are in no way concerned with that. These are non-modifiable factors, because when it comes to smoking, radon gas, and all these things, asbestos, we can prevent exposure. But when it comes to genetics, that's not in our hand, because we get our genetics from our previous generation, from our parents. So there are certain genes which are highly susceptible to particular cancer. Suppose if a family has got a certain genetic mutation and which runs in the family, so that particular family will become highly susceptible for a particular cancer. Even though the genetic basis or the hereditary basis of lung cancer is little known, I mean, not very common, like as we see in the breast cancer, the ovarian cancer. But there is certain genetic mutation like TP53 gene, which runs in the families, which causes a syndrome called as Leaf-Romani syndrome. So all those patients, whoever has got a TP53 gene mutation in lung cancer, probable cause might be, there may be a familial association for the causation of this particular cancer. So when we extend this discussion, something like smoking marijuana cigarettes, which is not very common in our country, but it is very common in the Western world. It also causes lung cancer. And when it comes to nutrients, there is not much association. I mean, so when they want to test whether providing a particular person with good nutrient food is going to prevent cancer, so what they tested in the clinical trials is, so they gave vitamin A to all the smokers and see whether lung cancer can be reduced. To their surprise, what they have noticed is all those all those smokers, whoever has received vitamin A, has got more lung cancer. So in all types of diseases, what we see is when we take good nutritious food, it is going to reduce the cancer. But when this particular vitamin A is given for a smoker, there is increased risk of, they have observed there is an increased risk of lung cancer. So these are certain risk factors which we can, which everyone has to know.
Yes, exactly, Dr. Sudhir. You have talked about how there are certain which are modifiable risk factors and some are non-modifiable risk factors. When we talk about smoking and tobacco as being the primary risk factor, what about passive smoking? Because I have seen people who will say that I did not smoke a cigarette, but I still got lung cancer. Do you think environmental exposure to polluted air, like you talked about pesticides, so that change in lifestyle is also an important factor when we talk about the risk factors?
Definitely, passive smoking is a major, I mean, is one of the major causes of lung cancer. Because when we talk about passive smoking, where are we, exposing to that particular passive smoking? Person by himself or herself is not a smoker, but at a workplace or at home, there is a smoker, and then we are constantly exposed to that particular passive smoking. So we can never change. We can neither change our workplace. We can neither change our home. So I think um, if that particular person, if we are going to work with that particular person, I think we are going to expose to that particular smoke for a continuous period of time. And we work in a closed spaces, so where there is no good ventilation, there is no good airflow. So whenever that particular person is smoking, the problem is he is taking smoke which is completely combustible. But what we are exposed is, there are two types of smokes which we are exposed here. One is incompletely combustible, which comes from the tip of the cigarette, and completely combustible, I mean, which is from the smoke of that person, which has been exhaled out. So for both these things, we are exposed. So, but that particular person is exposed to only one smoke, but we are exposed to two smokes here. One is combustible, the other one is incombustible. The incompletely combustible smoke is highly dangerous because it is I mean, it is combust only partially. So this has got more dreaded chemicals than the real smoke. It causes, passive smoking causes hazards, health hazards in both adults and children. When you take adults into consideration, they can cause cerebrovascular strokes, it can cause nasal irritation, it can cause lung cancers. In women, it can affect reproductive health by causing low birth weight babies. And then in children, when you take children into consideration, because children live with us in our homes, when there is a smoker in the home, then they are at risk of that passive smoking right from a very tender age, and it goes on for years together, even though they are not smoking. So they can cause, I mean, this particular passive smoking can cause sudden infant death syndrome. They can cause a lot of allergies. Then they can cause lower respiratory tract infections, repeated cough, shortness of breath. I mean, there are a lot of hazards with that of smoking. Whatever the smoker gets, I think at a lesser extent, most of those particular problems are experienced in non-smokers or passive smokers.
Dr. Sudhir, you talked about, some of the early signs and symptoms. You talk about shortness of breath, then of course, continuous cough is there. What other important and pertinent signs of lung cancer that people should be aware of in order to go for early detection?
So, suppose if there is a cough, so just presence of cough or presence of shortness of breath doesn't signify anything. It can be a lower respiratory tract infection also. So what we do is we go and then take regular medications from our family physician, whoever it is. So after 1 or 2 weeks, the symptoms should subside, or we should be able to tell what it is. If the symptoms are not subsiding, even after standard treatment, then I think there should be a strong suspicion there is something wrong, and we have to go for evaluation. So, what are the common symptoms of lung cancer? One is cough. It can cause shortness of breath. It can cause chest pain. Sometimes it can cause wheezing. It can cause sputum with the specks of blood. I mean, hemoptysis, which we call as blood in the sputum. It can also cause hoarseness of voice changes. It can cause dysphagia, which is difficult to swallowing. Odynophagia, I mean, painful swallowing. And some people may present at a very late stage with neck swellings, I mean, which indicates that the cancer is already spread to the neck nodes. So these are certain important symptoms that means we should be aware of.
Dr. Sudhir, you have talked about two kinds of lung cancer. What about the treatment modalities for both of them? If you could take us through the different stages in lung cancer and what are the treatment options that are available for lung cancer?
So broadly, this particular lung cancer disease is divided into two histological subtypes. One is non-small cell lung cancer, the small cell lung cancer. Small cell lung cancer is exclusively seen in smokers. Non-small cell lung cancer can be seen either in non-smoker or the smokers. So if you take non-small cell lung cancer into consideration, both these cancers can be divided into 4 stages: stage 1, 2, 3, and 4. Stage 1 being the early stage 4 being the late stage. Stage 1, stage 2, stage 3 cancers are curable cancers, and stage 4 is incurable disease. Even though stage 4 is incurable, we treat patients. The reason being we can control the disease and can prolong the we can prolong the duration of life, and then we can give the quality of life for those patients. Coming to the stage 1, 2, 3 patients, for these patients, there are 3 modalities of treatment mainly. One is surgery, second one is radiation, third one is chemotherapy. Sometimes we might have to give all 3 modalities of treatment to a single patient, depending on the stage of the patient. For a very early stage, we go for surgery without the need for radiation or the chemotherapy. Suppose if the patient has got second stage or the third stage, then we may have to go for surgery followed by chemotherapy plus radiation, plus minus radiation. Suppose if it is stage 3 cancers, then there is no role for surgery. Maybe we have to give only chemotherapy plus minus, chemotherapy with radiation. When it comes to stage 4, there is only one modality of therapy, that is chemotherapy or with the help of medications. When it comes to non-small cell lung cancer, usually what we say is whenever there is a patient, whenever there is a lung cancer, what we know as a general public is it is caused by smoking. But majority of the times, what we are seeing now in our clinics is there are nearly 30 to 40% of the patients who are non-smokers, but still they are getting the lung cancer. What could be the reason? Because other risk factors which I have elucidated just now, that could be the reason. So there are certain genetic mutations which happen. These are not mutations which are inherited from our previous generations. These are mutations which we have acquired in our own lifetime and which we are not going to pass on to the next generation. These are called as somatic mutations. So these are the somatic mutations which, because every cell in the body keeps on dividing. When there are divisions, cell divisions, new cells are formed and old cells die. When new cells are formed, there may be some defects in the DNA. So there should be some foolproof system in the body which can detect those particular defects and then remove those defects and then make it perfect. Suppose if there is a problem in the defense mechanism which they cannot detect that particular abnormal DNA that gets into the system, and then whatever cell that gets from that particular cell is going to be the abnormal cell. Like that, we get diseases. So there are certain genetic mutations, certain somatic mutations which have been identified in non-small cell lung cancer patients, like EGFR mutation, ALK mutations, RAS1 mutation. So these mutations are the driver mutations, what we call as these are the mutations which are causing the cancer in that particular patient, even though that particular patient is a non-smoker. So what we have now is we have got good drugs to target. These are called as this EGFR mutation, ALK mutation, RAS mutation. These are the targets, and we have targeted therapies for that. So by giving targeted therapies, we are not exposing them to the chemotherapy side effects. I think with the help of this targeted therapy, we are significantly prolonging the life of these patients, making their lives, much more durable and then much more comfortable, giving good quality of life. Coming to small cell lung cancer, there are only 4 stages here: stage 1, 2, 3, and 4. Stage 1, 2, 3 being early stage, stage 4 being advanced stage. As I told already, the stage 1 has got surgery, stage 2 has got chemotherapy and radiation, stage 4 disease has got only chemotherapy and immunotherapy, plus minus immunotherapy. These are the treatment modalities which we have to be aware of.
Dr. Sudheer, if we talk about screenings, you think somebody with a positive smoking history, when should they start screening themselves?
The patient should be less than 50 years. I mean, they can start screening with the help of low dose CT. They have to do it annually. Doing one CT at one point of time, not doing that afterwards is not going to make any difference for them, because this is an evolving disease. If a particular lung lesion, nodule is not seen this year, that doesn't mean that it's not come in the next year. So that has to be done at a frequent intervals. Patients should have smoked at least one pack per day for 20 years. And they should have smoked, they should have smoked in the past, at least in the past 15 years. So these are certain criteria. All these criteria have to be fulfilled for a person to undergo screening for lung cancers.
Dr. Sudheer, if we talk about counseling, because once a person comes to know that he's suffering from lung cancer, stage 1, 2, or even 4, you think counseling plays an important part in the overall journey of the patient? What role does counseling play?
Yeah, definitely, because this is a chronic disease. This is not going to go away in 1 week or 10 days, because the treatments are going to be complex. The treatments are going to be sequential. One after the other, the treatments have to be given, and the patients are going to be with us for a very extended period of time. So I think counseling plays a major role in all these patients. Second most important reason for the counseling is the treatments also have got some adverse effects. So all our patients have to be aware of those side effects, so that they can deal with them properly and then get into the clinical notice whenever they get that particular complaints. I think counseling plays an important role. Second thing, in a disease like lung cancer, where majority of our patients are presenting at stage 3 and stage 4, relatively advanced stages, it is always important for us to explain regarding the stages of these patients and then prognosis of the patient to the family members, so that family members are mentally prepared for the events which are going to happen at a later part of the life, because they should not be thinking that just because we came to the doctor at a particular point of time, the disease will go away. These are chronic diseases, and majority of them are not going to get cured. Patients and family members have to be aware of all these things. So counseling plays a major role in management of lung cancers.
Right. And caregivers also constitute the major backbone of the whole process. And do you think these, patient advocacy groups, and where all these survivors, they come together and discuss things, so when you hear about a positive story, somebody who's undergoing treatment and he'll get to know about a positive story, it will have a positive impact. So do you think these advocacy groups and survivors coming together, because in India we do not have the concept, but in Western there is a use of these groups also to give right kind of information and awareness to the
Definitely, the advocacy groups and the patient support groups, they give a lot of positive attitude. They inculcate a lot of positive attitude, and then they tell the prospective patients about the good things that they are going to get out of this. They can also tell that because they are survivor, they have crossed through this problem. I think by looking at them, by hearing to them, I think these patients will get a lot of confidence, self-confidence, and then they can face the problems, whatever they are going to get out of the disease, or because of the secondary to the treatments. Like for example, suppose the Angelina Jolie effect. invest. Suppose BRCA1, prior to that also there was BRCA1, BRCA2. Every one of us are aware of that. There is a genetic mutation. Just because there is a lot of noise regarding this BRCA1, BRCA2, entire world started thinking about that BRCA1 and BRCA2, and most of the prophylactic procedures, most of the things are being done and at a greater volumes after that particular episode. So advocacy group plays a major role, especially when the cancer patients or survivors speak to the patients. Definitely they will have positive attitude, and then I think that will also change the mindset of the patients.
Right, Dr. Sudheer, changing the mindset and getting him on a positive trail is very important. Coming to the risk factors, because there are a lot of myths and misinformations related with lung cancer or any other form of cancer for that matter. So do you think chronic obstructive pulmonary diseases or somebody with pulmonary TB, are they at an increased risk of lung cancer? Does that impact that?
Definitely, any inflammation in the body has got inflammation causes the damage to the tissue, and then there is a proliferation. I mean, a lot of new cells will come out. When there are new cells that are coming up, there may be some defects that can lead to particular some other diseases. Definitely, COPD is a disease of elderly, and this COPD and lung cancer have shared etiology like smoking, and both of them has got common genetic predisposition. Both COPD is also genetically predisposed. Lung cancer, as I told just now, it also has, in certain subset of patient, it is genetically predisposed. I think having a chronic inflammatory conditions like COPD, pulmonary TB, I think they play a role in causation of this particular lung cancer.
Talked about tobacco and smoking as the primary risk factor. So apart from quitting smoking, are there any other lifestyle interventions that individuals need to take to ensure that they are not amongst the high risk group? Of course, there are factors which are non-modifiable, like we talked about genetics and family history. But when it comes to modifiable factors, what 5 things would you tell our audience to go for that preventive approach when we talk about
lung cancer? Not only for the lung cancer, for any cancers, or for that matter, for any chronic disease, I think the food we eat is going to make a big difference. Our plate should be as colorful as possible. Should have a lot of fruits, a lot of vegetables, a lot of whole grains, millets, pulses, less of carbohydrates, more of proteins, less of sugar, less of rice, more of pulses. So I think when it comes to diet part, this is one. Number 2 is exercise is going to make a big difference in preventing most of this lifestyle. I mean, in this type of malignancies. If not the lung cancer, at least for majority of the malignancies. And stress-free life. Stress is also known to cause certain changes in the body, which by having stress-free life, I think we can prevent majority of these diseases. And having sleep at least 7 to 8 hours, good sleep, sound sleep, at least 7 to 8 hours per day. I think these are the 4 or 5 things which I would tell our audience to follow.
Right. Very rightly, you've talked about how lifestyle change can help in, preventing the disease. Now, when we talk about somebody who has been diagnosed with lung cancer, what would be your message to them? If you had to give some positive stories, or in the course of your practice, you have seen some positive stories that you would want to share with our audience.
Definitely, after 12, 14 years of experience, we have a lot of good stories to tell, even in case of even in a disease like this. So when I started my practice in 2011, 2010, what we are trained is different. What we are practicing is different, because the science is rapidly evolving. We are understanding the biology of the disease in a better way, and then we are trying to get more and more better drugs for our patients. So just because the person has got stage 4 lung cancer doesn't mean the person is going to die in the next 3 months or 6 months. Maybe without treatment that may be true, but with treatment, with good treatment, I think majority of the patients are living for a longer period of time. So So having a diagnosis of lung cancer doesn't mean that the patient is going to die in a short period of time. So there are good targeted therapies available now. No, it's not like a chemotherapy for all the patients. It's not the case now. So nearly 20 to 30% of our patients do not receive lung cancer patients do not receive chemotherapy at all in their entire treatment period, because the science has evolved and we are treating the disease. I mean, we are not treating the disease as a one size fits all. Each lung cancer patient is going to be different. Suppose there are 10 lung cancer patients who are all stage 4 having stage 4 diseases. All of them are not going to receive the same treatment. Each one of them will receive the different treatment. So we should not compare with our the patient next to us, that a particular patient died within 6 months after diagnosis. It doesn't mean that that particular patient is also going to die in the next 6 months. Because I have a patient who presented with stage 4 disease in 2016. Still, she is living even after 6 years. So there are stories to tell. So I think just because the diagnosis is stage 4 lung cancer, they should not demoralize, and they should continue the treatment as advised by the treating physicians.
Right, Dr. Sudheer, you rightly pointed out how customized and individualized treatment options are there. And if we talk about new and innovative therapies which are there, while it is immunotherapy, precision oncology, what are some of the breakthrough that you feel will change the scenario when it comes to lung cancer treatment in near future?
So let me take you back to the few years back. So there was a point where there was a period where we used to just say whether it is cancer or not. Then slowly science has evolved. Then we started looking whether it is adenocarcinoma or non-small cell lung cancer or the small cell lung cancer. Then slowly the science has evolved. Then we started looking whether what is the reason for this particular lung cancer. But for this particular non-smoker young female getting affected with a lung cancer, then people found out there are certain mutations which are responsible. Then they started targeting that particular mutations. So now what we are doing, there are days when we used to depend on biopsy, tissue specimen, and then do biopsies and then treat accordingly. Now what we are doing is we don't even, for lung cancer patient, we don't even need a tissue biopsy. We can just draw the blood sample and then send for analysis. We get a report within 2 to 3 weeks that is called a liquid biopsy. So for a patient of lung cancer, we don't need to have a tissue biopsy. We can treat that particular patient with the help of liquid biopsy. So this is one of the innovative and breakthrough as far as the diagnostics is concerned. We are exactly staging the disease these days with the help of PET CTs. We're not, we are depending on CTs, but exact staging is being done with the help of PET CTs. So we are upfront itself, we are able to tell what exact stage is. Third important thing is with the therapeutics. There are a lot of advances when it comes to, because when you send that liquid biopsy, that particular report will give you what mutations are there in that particular sample, what drugs can be used in that particular mutation, that particular genetic alteration, so that it is so personalized that no two patients will get the same therapy. So each one of them will have a different therapy, even though all of them are having the same disease with same stage. So these are some of the breakthroughs. There are a lot of advances when it comes to supportive care therapies also. Previously, whenever we give chemotherapy, people used to have a lot of side effects. But now all those side effects can be well managed with the help of available good supportive care medications also. I think these are the few innovations which helped us to take care of the patients in a better way.
Right, Dr. Sudheer. Finally, before letting you go, what would be your advice to the youngsters of today? Because when we see them vaping, then hookah, e-cigarettes, and they say it's not as harmful as cigarettes, what advice would you give them?
No, it's like suppose if someone is a smoker, minutes after if you quit smoking, minutes after quitting smoking, heart rate drops down. 24 hours after quitting smoking, blood nicotine levels will drop down to 0. Nearly 1 to 2 days after quitting smoking, carbon monoxide levels in the blood comes back to that levels of the carbon monoxide as we see in the non-smoker. 1 to 2 years from this quitting of smoking, I think the risk of stroke will drops down by half. 10 to 15 years from quitting smoking, I think all these cancers, whichever smoking related cancers, the risk will become half. 20 years after quitting smoking, all these cancers will come to the level where general population is also at risk. So the fact of the matter is, how much ever someone has smoked, how many years they have smoked, it is never too late to stop smoking, because even a single day will make a big difference. So it's always better to follow the healthy lifestyle to prevent these dreaded diseases.
Thanks for taking out time and joining us today, Dr. Sudheer. I'm sure our audience took away a lot of relevant information on quitting tobacco and smoking, and how a healthy lifestyle can help mitigate the risks of lung cancer. Thanks for being a part of this discussion, and thank you for being there.
Thank you for the opportunity.
Keep on following our social media pages for more updated information on health and well-being.